My name is Jason Tarkin, and I am a Wellcome Clinical Research Career Development Fellow at the University of Cambridge. Cardiovascular disease is common. According to the British Heart Foundation, someone is admitted to a hospital in the United Kingdom every 5 minutes with a heart attack. Fortunately, diagnostic tests and treatments for cardiovascular disease are good. Most heart attacks are caused by a sudden blockage of a major artery that supplies blood to the heart because of the buildup and rupture of dangerous cholesterol deposits called atherosclerotic plaques. Here is an example of a patient with atherosclerosis of the left coronary artery, shown by CT and X-ray angiography. However, each year, 1 in 3 people with a heart attack will not survive. And within 5 years, 1 in 5 people will have a recurrent heart attack or develop heart failure. Here's a series of CT and MRI images from a patient with a recent heart attack. Even though the blocked artery has been opened with a stent to restore blood flow to the heart muscle, there's extensive heart muscle damage with scarring and impaired contraction. Identifying people with heart disease who are most at risk of future events remains challenging. Decades of research have demonstrated that inflammation is a key risk factor for cardiovascular disease, which is involved in all stages of the disease process. Therefore, inflammation could represent an important target for the detection and treatment of cardiovascular disease. In fact, we are now on the brink of a new era of anti-inflammatory therapies for cardiovascular disease. Several major research trials have shown this approach to be effective in reducing cardiac events in people with heart disease. However, better ways to identify and risk stratify people who would most benefit from these newly emerging anti-inflammatory therapies are urgently needed. Our research at the University of Cambridge aims to apply novel multimodality imaging techniques to better understand the role of inflammation in heart disease. Here's an example of multimodality cardiac imaging performed in a patient using a combined PET and MRI scanner. PET imaging is used in clinical medicine for a variety of purposes. A PET scan involves injection of a radioactive tracer, which circulates around the body and tags cells of interest, allowing them to be located by the scanner. Our research has helped to discover a new method for detecting cardiovascular inflammation using a PET tracer called gallium dotatate. We and others have shown that this PET tracer binds to inflammatory cells within atherosclerotic plaques called macrophages. Here's an example of CT and PET images from a patient with a recent heart attack. Using the experimental PET tracer gallium dotatate, very clear inflammatory signals are localized to the affected artery and heart muscle. In contrast, imaging performed using a conventional PET tracer called FDG was not useful because of non-specific signals from the heart. In order to translate these findings to the clinic, we are now conducting a series of PET imaging studies in different clinical scenarios to investigate the association between inflammation and disease progression in patients with heart attacks, to evaluate new drug therapies that lower inflammation, to help discover new ways to identify people at high risk of cardiovascular disease, and ultimately to help stop heart attacks before they occur. Thank you for listening, and thank you to the funders, our collaborators, and particularly the patients for volunteering to participate in this exciting research.